Personal care and grooming are important factors in maintaining health and controlling infection. As a care provider, you may be responsible for the personal care and personal hygiene for persons who are not capable of doing these things for themselves. Personal care includes areas such as nail care, hair care, shaving, and dressing and undressing. Guidelines for proper oral hygiene and bathing a resident, both important components of personal care, are presented in separate programs. Fingernails and toenails must be kept short, clean, and free of rough edges. This helps prevent damage to the skin and provides a pleasant appearance. Diabetes or circulatory problems may mean a nurse or podiatrist is required for nail trimming. To perform the procedure, you'll need to obtain nail clippers, an emery board or file, orange sticks, hand lotion, a towel, and a basin of warm water. Before you begin, identify the resident and explain what you're going to do. Provide privacy for her, and be sure to perform hand hygiene before giving care. After making sure the water is warm, soak the resident's nails for 10 to 20 minutes. Then dry the resident's hand and clean under each nail using an orange stick. After cleaning, wipe the fingers and hand with a towel. Then use the clippers to trim the nails to the desired length. Be careful not to injure the skin while trimming. After trimming, file the rough edges with the emery board or file. Repeat the procedure for the resident's other hand. As you work, inspect the resident's nails for signs and symptoms of infection. If you see nails that are yellow or white, are unusually thick or broken, or nails that are ingrown, tell the charge nurse or your supervisor. To finish, apply the hand lotion and massage the hands. If the resident wants it, apply nail polish. The care of toenails may require the services of a podiatrist or other professional, but a nursing assistant or other care provider may soak the toenails in warm water to soften the nails prior to trimming. Inspect the toenails for skin integrity, proper circulation, and signs of swelling. Check between the toes and in between the toenails for areas of redness or cracked skin, and note any unpleasant odor. Report any unusual findings to your charge nurse. When you are finished, make sure the resident's feet are dry and comfortable. Perform hand hygiene again. Discard the disposable materials and return all of the equipment to its proper place. Document the procedure according to the facility policies and be sure to report any changes or signs of injury to your charge nurse or supervisor. Shaving facial hair is a daily task for most men. If a male resident is able, encourage him to shave himself. If he needs help, you can shave his beard with his electric razor. If he doesn't have an electric razor, use a disposable razor. To shave with a disposable or safety razor, you will need a basin of warm water, a washcloth and towel, shaving cream, a disposable razor, aftershave lotion, and a pair of gloves. Shaving may be performed before, during, or after the bath. Be sure to perform hand hygiene before giving care. Then identify the resident, tell him what you are going to do, and provide privacy. Then put on the gloves, since a nick while shaving the resident may expose you to blood-borne pathogens. After placing the resident in a sitting position, begin the procedure by spreading the towel under his chin. If he has dentures, make sure they are in his mouth. Then soften the facial hair with some warm water and a warm, wet washcloth. Rinse out the washcloth and set it aside. Apply shaving cream generously to the face. Ask the resident to tell you if he becomes uncomfortable at any time during the procedure. Hold the skin taut as you shave in the direction that the hair grows. The razor should be held at a 45-degree angle and moved over the skin in short, firm strokes. Work down over the cheeks and chin. Use the razor in the basin often when shaving cream builds up on the razor's edge during shaving. Shave upward under the chin using firm, short strokes. Be especially careful around the nose and mouth. If you do nick the skin, report it to your charge nurse or supervisor. When finished, wash off the remaining shaving cream, rinse and pat dry. Offer to apply aftershave lotion. Remove and discard your gloves. Finally, make sure he is comfortable. As with all procedures, remember to perform hand hygiene. Collect the shaving materials and return them to storage. Dispose of the used razor in a sharps container. Document the care that was given. Report any unusual occurrences to the charge nurse or your supervisor. Providing hair care and makeup can be an important part of good personal grooming and promotes self-esteem. Encourage participation, but often you or another care provider will do all of the residents' hair and makeup. Hair should be brushed or combed daily according to the resident's preference. Obtain a brush or comb, a hair dryer, and a towel. You may also need hairspray or any other hair products she desires, and the preferred makeup. Be sure to perform hand hygiene before giving care. Explain what you will be doing and provide privacy. Identify the resident. It may be desirable to place a towel under the resident's head or across the shoulders before you begin to catch any loose hair during hygiene. Now you're ready to begin. Hair care may begin by first washing the resident's hair and drying it with a towel. Then brush or comb the hair free of tangles. As you brush, observe the resident's hair and scalp. Report any conditions such as flaking, scaling, or redness of the scalp, or severely matted or tangled hair. Try to determine the hairstyle a resident wants. A wrong style can be upsetting to a resident. Childlike styles are not appropriate and should not be used. You may wish to blow dry the hair while styling it. Use a low or medium temperature setting to keep the heat setting low enough to avoid burning the resident's scalp or face. If the resident wants it, you may use hairspray or other styling products may be used if she desires. Allow her to see what you're doing and listen to any suggestions. Many facilities provide the services of a professional hairdresser. Ask her or family members if they would like you to arrange an appointment. Help her apply makeup if she wants it, but be sure that the types of makeup you select are appropriate and maintain her dignity. Avoid any heavy application of makeup. Once you're through providing hair care and makeup, make the resident comfortable. Perform hand hygiene again. Return the supplies to the proper storage area. Document the care. Report any unusual occurrences to the charge nurse or your supervisor. Another important self-care skill can be providing assistance with eyeglasses and hearing aids. Encourage participation in the care of these devices as much as possible. However, sometimes partial or total assistance is needed. Identify the resident you will help, explain what you are going to do, and perform hand hygiene before you provide any care. Eyeglasses and hearing aids are special and expensive items and should be protected from loss. Make sure they are labeled with the owner's name and always store them in the same place when not in use. Before you put on a pair of eyeglasses or a hearing aid on a resident, clean both items. Clean eyeglasses with a special solution or with soap and water. Dry the lenses with a soft cloth towel. Never use a paper towel or napkin because they may scratch the lens. Before putting the eyeglasses on, check the bridge of the nose and behind the ears for sores caused by the glasses. If there is redness or any break in the skin, report it to the charge nurse or your supervisor. Make sure the eyeglasses fit properly. Be sure to report if they do not fit or if the frame or lenses are damaged in any way. To clean a hearing aid, follow the recommended procedure. If you don't know the procedure, check the instruction booklet or ask your supervisor. Before putting on a hearing aid, observe the ear for wax buildup or sores. If present, notify the charge nurse or your supervisor. Make sure the volume control is set at its lowest setting. Put the hearing aid in place and then turn it on. Check with the resident to make sure it is working properly and help with any adjustments. If the hearing aid does not work properly, notify the charge nurse or your supervisor. Follow the instructions for testing the batteries. Also, be sure the resident has extra batteries on hand. When you are finished assisting with eyeglasses and the hearing aid, return any supplies to their proper place. Then perform hand hygiene. When she is finished using the eyeglasses or a hearing aid, be sure to store them in their protective cases. Tell the resident where you are placing them and put them within easy reach. Document the care. Report any unusual occurrences to the charge nurse or your supervisor. Dressing the totally dependent resident in her own street clothing will not only help keep her warm, but will make her feel more comfortable and more in control of her life. She should be encouraged to do as much of the dressing for herself as possible. To prepare for dressing, be sure to perform hand hygiene before giving care. Identify her, tell her what you're going to do, and provide privacy. Obtain and select the clothing with her participation if possible. Raise the bed to a comfortable working height. Lower the side rail if necessary and fold down the bed covers. To protect her privacy and dignity, help her to put on her underwear while she is still wearing her gown. Then help her to put on her pants. Reach through the leg of the pants for the leg that is farthest from you. Grasp her ankle and slide the pants on over your hand. Follow the same procedure for the near leg and slide the pants up as high as possible. Encourage her to raise her buttocks if possible to make the procedure easier. Adjust the pants around the waist and close the fasteners on the pants if necessary. Then untie the gown and pull it off over her arms. For privacy and warmth, keep the gown over her. Help her put on her bra. Place the bra in position, then fasten it in the back. For a pullover blouse, shirt, or dress, reach through the sleeves one at a time to grasp the wrists and place both sleeves over the arms. Pull the blouse as high as possible on the arms. Grasp the neck opening and slide the blouse over the head. Encourage her to sit up if possible to make the procedure easier. Put on the socks or stockings, then put on the shoes. For a front opening sweater, shirt, or dress, reach inside the sleeve and grasp the wrist. Slide the sleeve over your hand and onto the arm. Pull the sweater around and reach through the other sleeve to grasp the arm and pull the second sleeve over her arm. Button the sweater if she desires. After she is dressed, remind her that the call signal is on her bed and within reach. Make sure she is comfortable. Finally, be sure to perform hand hygiene after giving care. Document the care and report any unusual occurrences to the charge nurse or your supervisor. Dressing a resident who has an IV catheter requires a slightly different technique and special considerations. You must be careful to avoid dislodging the IV catheter and to avoid lowering the IV bag or bottle below the level of the resident's arm. Your charge nurse will perform this task, and you will assist in this procedure. Be sure to perform hand hygiene before giving care. Identify the resident, explain what you're going to do, and provide privacy. Help him select his clothing. You should choose only loose-fitting, short-sleeved clothing to permit observation of the IV catheter. Pull down the resident's gown to about midway to his chest while your charge nurse adjusts the flow of the IV manually. She will remove the IV bag from the pump and slide the bag and tubing down through the sleeve from inside to outside. To redress the resident, you will adjust the resident's shirt so that the charge nurse can carefully slip the IV bag and tubing through the sleeve. She will then rehang the bag and set the rate again. Adjust the resident's clothing as needed. Button the garment. Complete the remainder of the dressing procedure in the same way you learned earlier. Helping with personal care and grooming not only requires skill and practice, but also sensitivity. Try to imagine how you would feel if you were no longer able to provide these services for yourself and someone else had to offer them. You should be aware of the particular needs and preferences of each resident and provide care in a way that preserves their dignity and sense of self-worth.